So we start with some effleurage strokes, you can see here, just to get contact with the person. And the first one we're just going to work is, of course, to clear the terminus that we talked about before. So you can see that going down clavicle into the supraclavicular fossa, as you learnt before. Now I'm going a little faster than you'd normally do it, just so I don't take up too much time. And again, you'd normally do 5 to 7 repetitions. I'm just doing a few more, just so, because it's new to you, so you can practice, but around about 5 to 7. Now we're going to work around, and we are going to go down the back of the neck there, or the side of the neck, like you did on yourself there. So my fingers are right to the back of the neck, and we're working as much as the neck as possible. And remember, we're going back and down. So always going down towards the supraclavicular fossa. So you see that there, just going back and down. And now, depending on the size of your hands, you might want to do 2. I'm just going up a little bit. Of course, Liam being so small, I don't need to. My hand fits right along the side, the length of his neck. But you might need to do 1 or 2 hand positions, or maybe even 3, depending on the size of the person you're treating and the size of your hands. So I'm just coming back down again to clear where I've just been. So you just want to cover the whole neck there. Alright? And then we're going just back to clear the terminus again. So you really want to open this all out, and really, as I said, you open the drain, if you like. So it's really important that we do this well. So you can see that there. So I'm just repeating again. Now, okay, so I'll just show you this one. We did this. You've got the finger in front of the ear, and the other finger's behind the ear. And you've got those auricular nodes and cervical nodes, and we're just going back and down again. So just back and down as you're working through here. And then release, you can see that, release, and then down, get that stretch as we're activating the stretch receptors in the lymph to bring it all down away from the head there, or the neck and head. So you can see that, we're just working that. Again, I might be doing a few more than just 5 or 7, just so you get a good look at it. That's just basically what I'm doing that for. So now just below the ear there, working through there. So you're clearing the whole neck. I mean, it's not rocket science, as long as you know your direction and you can repeat where you want to, and you just keep going backwards. Now again, this depends on the amount of time you're going to do the treatment, how many times you might want to repeat it, or how severe the person's condition is. And but that's basically it. You're clearing the terminus, like I say, through the supraclavicular fossa, and also clearing out through the neck, along the sides of the neck. Now, what I'm going to do here is, you've got lymph nodes at the occiput there. So put your fingers back at the occiput. All right, the base of the head, for the base of the skull. And once again, exactly the same thing, is working down. You're working down and forward. I don't know how clear it is, you can see that, but my thrust phase is down and towards the side anterior, because of course we're wanting to bring that forward into the front of the neck there. So it's down and a little forwards, if that makes sense to you. And so I've just moved a position down slightly inferior to the occipital line there. So we're bringing it down. We've cleared it out and we're bringing it down. So bring it down and forwards. And of course you could work a little bit further posterior on that trapezius to bring it forward. But again, as long as you know, I'm just going to bring that, so I took that pillow out just for ease of access of getting into the back of the neck there. So when you're working right at the posterior aspect of the neck, just think you want to bring it forwards and down. All right. So think, where do you want to bring it? So where are your thrust phase? Well, you want to bring it down and towards that sternum area, the front front of the lower area of the throat there, the clavicles in the midsection. All right, so that's really all you need to think about. Like, okay, where do I need to take it? All right, so I'll really clear the terminus first, and then work my way along the sides and the back of the neck, working through there as you really clear the neck. And this is called a pre-treatment. Now I'm just going out laterally, right on top of the acromions, okay, and bringing it towards that center line. So right on top of the acromion. So we're just getting right out. So we're making sure that we're really clearing all the lymph nodes. Now again, this is what you're going to do on any treatment of the body. You will always clear the terminus. You will always do the neck treatment on any treatment. So if you would just want to do someone's arm, for example, then you would still always start this. We've got to open that drain, clear out that area. Okay, so always start with some effleurage, as you'll see as I go along, and finish with some effleurage. It's really nice. It introduces your hands to the person. And there you have it. That is the neck treatment. Little butterfly stroke, as I call it. There you are.